If I'm travelling and I fall ill, what do I do? Because a doctor will not see you now if you're not registered.
If we are a traveller, one of the things we are likely to do is travel, go to different places. We might be on the road for a while, moving around the countryside to different places. And one of the things that often worries us when that's happening is, what do we do if we get ill? Where do we go? How do we get help? And there's a perception that GPs will not see you if you're not registered with them. Now, it's true that GPs do manage lists of people who are registered with them, but they equally have a responsibility that's written into their contracts that they have to see anybody who is temporarily resident in an area, that's basically for less than 12 weeks, or if somebody needs treatment at once for something, then they can be seen. So it's important that you know that you can be seen at a GP practice at any time if you are temporarily in an area or you need some treatment immediately and you're not near your home GP. Now, obviously, we need to distinguish a little bit between things that are urgent. So if you've got chest pain or you're bleeding profusely or you're struggling to breathe, then going to A&E is an appropriate thing to do. However, if it's a less urgent thing than that, then going to the GP is much more appropriate, because one of our problems in the country at the moment is A&Es are getting overwhelmed with people who are going for things that aren't emergencies and aren't desperately urgent, just for routine things. So what we're trying to do is to make sure people who haven't got those kind of conditions go and see their GP. And it's important that you know as travellers that you can go and see a GP wherever you are, and it's your right to be seen for conditions that are appropriate for them. And of course, our ability to see a GP begs another question: is there anybody else that we can see? For many very minor conditions like a cold or a stuffy nose or hay fever or a wart or verruca or some general aches and pains, we can go and see our pharmacist. Pharmacists are trained to be able to manage many of those minor conditions, and they can help you, give you advice. Most have got a small consulting room now that they can see you in. So very worthwhile seeing your pharmacist if you are concerned about something. The pharmacist is always able to send you on to the GP if they feel it's more than they can manage, so you can trust them to see and assess your condition if it's minor.